really pleased to introduce or have the opportunity to introduce our summary of the VA DOD Clinical Practice Guidelines for type 2 diabetes mellitus. Hi, I'm Dr. Brian Burke. I'm chief of the diabetes section at the Dayton VA Medical Center in Ohio. I'm also the co-director of the VA Specialty Care Endocrine Diabetes Program Office for VHA Specialty Care. I invite you all to read the recent August publication in Mayo Clinic Proceedings, our summary of the VA DOD Clinical Practice Guidelines for type 2 diabetes mellitus. These guidelines were developed using the best evidence that was available at the time of the publication of the guidelines. We also used the grade system for evaluating research, specifically grading of recommendations, assessment, development, and evaluation system. We are really excited about some of the outcomes or some of the results of this analysis. Specifically, once again, the VA DOD Guideline Committee strongly suggested that we continue our support for diabetes self-management education and support, and also have encourage our primary care colleagues and PAC colleagues to refer frequently and especially early in the disease process. Some other noteworthy recommendations were the finding that real-time continuous glucose monitoring is now available to many patients with type 2 diabetes who are insulin treated. It also has been shown to increase or reduce the risk of hypoglycemia and improve A1C results. Also, patients with type 2 diabetes and cardiovascular disease should receive medications that show a benefit to reduce these disease-specific outcomes and complications, as well as mortality. Specifically, I'm talking about the SGLT2 inhibitors and the GLP-1 receptor agonists. Among older adults, we've also strongly made a strong recommendation that we prioritize the medications that do not cause hypoglycemia, and to avoid, if possible, the use of medications such as insulin and sulfonylurea, which have hypoglycemic risk. One of the other interesting findings from the results was that high glycemic variability over time is a prognostic indicator for hypoglycemia, morbidity, and mortality. As a result, additional studies are needed, but reducing glycemic variability in patients using CGM, A1C, or fasting blood glucose monitoring has been shown to potentially have benefit for reducing these risk factors. We also found that, to no one's surprise, that Mediterranean diet continues to be, with a modified low carbohydrate recommendations, continues to be the most evidence-based dietary recommendation. We also found that intermittent fasting was not particularly useful in the treatment of patients with type 2 diabetes mellitus. Other recommendations that you might find useful include that among patients with type 2 diabetes mellitus and heart failure, of course, we recommend SGLT2 inhibitors to prevent hospitalizations for heart failure. And of course, the renal protective aspects of these drugs remains high, strong recommendation in combination with GLP-1 receptor agonists to protect patients from progressing to macroalbuminuria. Other recommendations that you may find useful are the fact that among patients with type 2 diabetes mellitus, that physical activity, of course, has been shown to improve glycemic control, but not limited just to aerobic activity, but resistance training or Tai Chi has also been shown to have benefits. The another area that we also found interesting was the mindfulness-based stress reduction program showed short-term improvement among people with type 2 diabetes mellitus. Among patients with diabetes distress, while we all know there is a psychological burden to the day-to-day management of patients with type 2 diabetes mellitus, it varies among patients, and we couldn't find a significant amount of strong evidence in the areas of acupuncture, biofeedback, hypnosis, guided imagery, massage, yoga, Tai Chi that improved outcomes. So we were neither for nor against the recommendations for screening for diabetes stress. So that's a brief summary of many of the recommendations in this summary paper. I would encourage all of you to review the recommendations, and please provide us feedback or your thoughts with our corresponding author. And thanks again.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.